All right, thank you very much, Amber. Now, it just got more expensive to light up, as we told you at the top of this half hour. The cigarette tax went up 40 cents today. That means smokers will now pay $3 in taxes for a pack of cigarettes, which can average about $8. About 100,000 people smoke cigarettes here in Hawaii, approximately 15% of the population. So why not quit? And why are they raising these taxes? Well, joining us this morning is Valerie Smalley of the Hawaii Tobacco Quit Line. Good morning to you, Valerie.
Good morning.
Appreciate that for you being here. And Julian Lipscher of the Department of Health. And always good to see you, sir. Thanks for being back. Really appreciate it. And let's start with you, Julian. We're talking about this tax. Is this a tax issue or is this a health issue?
Well, it's certainly a win-win situation for the state and hopefully for smokers. Hawaii is one of 5 states that has a tax of $3 or more, and this translates into a tremendous opportunity to get people to quit.
And 15% of the population, what does that mean to Hawaii? How does that impact Hawaii when 15% of the population is smoking, as far as the cost, as far as the numbers, compared to the rest of the mainland?
Well, compared to the rest of the country, we're relatively low. We have a relatively low prevalence rate of smoking. But, you know, for a 15% prevalence rate, it costs this state about over $600 million a year in medical care costs and lost productivity. So even for a small, smoking prevalence, it's a huge cost.
And of course, 1,000 lives are lost each year because of smoking-related diseases. Valerie, what can people do to quit? If they say, okay, this is enough already, $8 a pack of cigarettes, enough, what can they do right now?
Exactly. I think the main thing is to know, first of all, that there is support out there. It is something that does take practice. To look at your calendar, look at a date that seems reasonable to you, to either call into the Quit line to sort of inquire about, different medications that might be available, or your health insurance plan, because that makes it easier. And maybe to start practicing. We call them mini quits. It's like, okay, maybe today don't smoke in your car, or delay your after meal cigarette. And that sort of starts the ball going. But to rally those around you, get support, and to look into the medications as well.
And if people are interested in contacting your organization, what can they do? Where should they go?
Well, I think there's a lot of options right now, because for those that want to call, it is toll-free, 1-800-QUIT-NOW, or 1-800-784-8669. And then they also can go onto the website, which is www.quitnowhawaii.org, for those that maybe want to look before they call.
And Julian, as these taxes get higher, these sin taxes for cigarettes, have we seen the numbers drop over the years as more taxes have been piled on top of cigarettes? Has there been a direct link?
Well, yes, but it's not only taxes. I mean, the most proven strategies are higher cost of the product, and the clean indoor air laws have kept, our prevalence rates low, and have actually helped decrease them. And they help keep people from smoking. They help prevent young people from starting. And in fact, that for every 10% increase in the price, you get a 4% decrease in consumption, and that number tends to double for kids. It reduces chronic illness, fewer people smoking. So it's win-win all around. It's a lot more than just a revenue-generating issue.
All right. Well, thank you very much. Julian Lipscher of the Department of Health, we appreciate you coming here, and also Valerie Smalley of the Hawaii Tobacco Quit Line.
Thank you.
Thank you very much. Thank you, sir. And keep fighting the good fight. And we'll be right back with more news. Hope you stay with us. And, of course, we'll also have one last look at traffic and weather on the fours. It is 6:50 on this Thursday morning, July 1st.